Acute Hepatitis E, South Sudan. Situation at a glance. On the 14th of April 2023, the Ministry of Health, MO, of South Sudan declared an outbreak of the hepatitis E virus, HEV, in Wau City, the capital of Western Bahr el Ghazal state and one of the largest cities in South Sudan. Between the 23rd of March 2023 and the 13th of April 2023, a total of 91 HEV suspected cases have been reported from Wau, of which 35 are confirmed. There have been 5 deaths reported. Case fatality ratio, CFR, 5.5%. A multidisciplinary national rapid response team has been deployed by the MO, supported by WHO, to conduct an epidemiological investigation, determine the extent of the outbreak, identify exposures or risk factors to prevent further spread and implement appropriate preventive measures. HEV is transmitted by the fecal-oral route, mainly through contaminated water. Hepatitis E is found worldwide and is common in developing countries with inadequate water supply, limited access to adequate clean drinking water, poor environmental sanitation, personal hygiene, and limited health services, or areas of humanitarian emergencies. Cases of the hepatitis E virus have been reported in the Bentiu camp for internally displaced persons, IDPs, in South Sudan since 2018, with seasonal upsurges reported yearly, particularly during the rainy season due to floods leading to contamination of drinking water. There is a risk of international spread of the disease as South Sudan shares borders with Sudan and Ethiopia, with substantial traffic between them. Description of the outbreak. In response, the MO, supported by WHO, immediately deployed a multidisciplinary national rapid response team to conduct an epidemiological investigation, characterize the event, determine its magnitude, and identify exposures or risk factors to guide control and prevention measures. 1. Between the 23rd of March 2023 and the 13th of April 2023, a total of 91 suspected cases of hepatitis E virus were reported and 5 were fatal, CFR 5.5%. 2. A total of 44 blood samples were collected and tested for HEV IgM antibodies, of which 79%, N equals 35, were confirmed. 3. Most cases, 93%, have been reported from Nazareth village in Wau South. 4. The median age of cases is 20 years, range 2 to 71 years. 5. Males are most affected, accounting for 74% of all reported cases. Epidemiology of disease. 1. Hepatitis E is a liver disease caused by the hepatitis E virus, HEV. 2. Hepatitis E is found worldwide and is common in developing countries with limited access to adequate clean drinking water, poor sanitation and personal hygiene, limited health services, or in areas of humanitarian emergencies. The hepatitis E virus is transmitted by the fecal-oral route, mainly through contaminated water. 1. The risk factors for hepatitis E are related to poor sanitation conditions, allowing the viruses excreted in the feces of infected subjects to reach water intended for human consumption. The infection resolves spontaneously in 2 to 6 weeks with a 0.5 to 4% lethality. Fulminant hepatitis, severe liver function impairment caused by HEV, is more common in pregnancy. Pregnant women, especially in their second and third trimesters, are at increased risk of acute liver failure, fetal loss, and mortality. The case fatality rate can be as high as 20 to 25% in women in the last trimester of pregnancy. 1. Globally, most human infections with HEV are attributed to genotypes 1 and 2, which primarily affect humans in developing countries where contamination of drinking water and lack of adequate sanitation are common, especially in sub-Saharan Africa and Asia. 2. Leadership and coordination. 3. The Water, Sanitation and Hygiene (WASH) cluster at the state and national levels is tracking the progress of the response. 4. WASH partners in hotspot counties, Wau and Ure River, continue to focus on integrating with the Infection Prevention and Control (IPC) and Risk Communication and Community Engagement (RCCE) pillars of the state MO, SMOH, task force. 5. The WASH cluster at the state level has established twice-weekly meetings. 6. WASH cluster sub-national coordinators attend SMOH task force meetings to get updates and relay them to partners. 7. Immediate activation of the Public Health Emergency Operations Center and all response pillars: coordination, surveillance, case management, WASH, IPC, RCCE, safe and dignified burial, points of entry, and logistics. Surveillance and case management. Maintaining the multidisciplinary National Rapid Response Team in WOW to continue supporting the SMOH and partners to mount a full-scale response in the areas of active case search and line listing of cases. Additional sample collection and testing at the WOW Teaching Hospital and the National Public Health Laboratory. Case management and IPC measures to health facilities, improving wash conditions, and IPC in affected communities. WHO risk assessment. Cases of hepatitis E virus have been detected in South Sudan and the Bentiu IDP camp since 2018. If the wash conditions are not improved, the potential risk to human health is high, especially for pregnant women and infants, as mother-to-infant transmission of HIV during the third trimester of gestation has been reported. The risk at the national level is assessed as high due to poor sanitation and hygiene practices, especially in the IDP camp, limited availability of safe drinking water, poor access to essential medical services, the presence of a large IDP population in South Sudan, financial constraints impacting capacities to effectively contain the outbreak and limited local capacity to carry out response activities effectively, the limited availability of vaccine supply, population movements, high risk of death in pregnant women in the absence of HIV vaccine introduction. WHO advice. Prevention is the most effective approach against this disease. At the community level, the most important interventions to reduce HIV transmission are safe drinking water, quality standards for public water supplies, and adequate sanitation. To prevent the spread of acute hepatitis E, WHO recommends improving access to safe drinking water and adequate sanitation. The drinking water quality should be regularly monitored in neighborhoods affected by this epidemic. Coverage of latrines and drinking water sources should be increased to prevent open defecation and to ensure hand hygiene. Health promotion and prevention activities, as well as ensuring early, appropriate, and equitable healthcare services to combat hepatitis E epidemics, can help improve public health outcomes, especially in resource-limited settings. Since the incubation period for hepatitis E ranges from 2 to 10 weeks, cases may continue to occur up to 10 weeks after measures to ensure safe water, sanitation, and hygiene promotion have been adopted.